Good evening, everyone, and welcome to our virtual family council meeting. My name is Jamie Rose. I'll be your virtual meeting coordinator. So we're going to review our confidentiality statement. Please refrain from using the name of your loved one. Do not name specific facilities. Please use a nursing home or the personal care home to present to the group. If you need specific assistance, please use the chat feature to state which county you are in, and we will get you connected to your assigned ombudsman. And just a reminder, these calls have public access and are designed for family members and friends of residents in long-term care facilities. Our meeting agenda this evening, we're going to get our virtual meeting tips from Jay, and then we're going to turn it over to our two presenters from the Department of Military and Veterans Affairs. And then at the end of the meeting, I'll hop back on and we'll review our upcoming meeting topics. Without further ado, I'll turn it over to Mr. Rotz.
Thank you, Jamie. Ladies and gentlemen, you've all been placed in mute upon entry. We'll open the lines a little bit so that you're able to share. If you would like to speak or have a question, please use the raise hand feature. Once you raise your hand, we will know to acknowledge you and unmute your line. The chat feature is at the bottom of your screen. If you have a question for the presenter, please message the chat moderator and they will ensure that your question is asked. If you need to step away, you can stop sharing your camera by clicking on the camera icon at the bottom of the screen. You can click on it again to start sharing your camera again. And finally, concerns or questions can be directed to me at the state office. That number is 717-783-8975 or by email at capital-LTC-ombudsman@pa.gov. Jamie, back to you.
Thank you so much, Jay. And at this time, I would like to turn it over to Gene Mizdail. He is at the Bureau of Veterans Affairs at the PA Department of Military and Veterans Affairs. So he's going to present on an overview of the state veterans homes.
Good afternoon, everyone. Can you hear me okay?
Sure can.
I did turn my camera on, so I believe you can see me. I had to be honest, Zoom, we've used Teams a lot here at DMVA, so I had to do a little bit of adjustment prior to the meeting, and I've just got a new laptop, but it should be okay. So what I'm going to present is what we call the Homes 101, and basically it is an overview of the state veterans homes. So I'll move on. There we are. The first slide is basically gives you the locations of the 6 homes in Pennsylvania. A lot of people are not aware that there are 6 long-term care, extended care facilities for veterans and spouses of veterans in Pennsylvania. So this is a slide really with the map of Pennsylvania to show you where the 6 homes are located. As I mentioned, I'm Gene Mizdail. I'm the Admissions and Outreach Coordinator located here at Fort Indian Town Gap for the Bureau of Veterans Homes. We cover all 6. And again, this is like the basic overview of the Homes 101. So next slide, please. Kind of the goals of this presentation, what we're saying is I kind of want you just so you have a little bit more knowledge about the 6 homes, kind of understand again how we're part of the DMVA, how we kind of fit into the DMVA. But the most important thing I do as admissions and outreach coordinator is work the admissions process. So we're going to talk about the admissions process and how an applicant would go about applying for a home, who qualifies and how they would apply. And then of course, as always, I'm an outreach person to reach out if you have a question, but I can't do it all myself. I do have a lot of people that work for me, and then I have a lot of people that work at the homes in admissions as well. So without that, next slide, please. This is a kind of a lotus slide. It's the hierarchy of the whole DMVA, and it's taken from the website. Really what I have this slide in the presentation. I just want that we are under the Adjutant General of Pennsylvania. Chip's going to talk a little bit more about the programs and outreach. But really, we're just the lower block. I guess I can't really point to it. I moved my cursor. I'm not sure if you could, I don't think you can see it, but the Veterans Home is to the far left under the Deputy Adjutant General for Veterans Affairs. So there's the 6 homes in the lower block. The next slide. This breaks down a little bit how the department is under the Deputy Adjutant General for Veterans Affairs. We're on the left. We have an Executive Director for Long-Term Care, that's Mr. Travis Davis. Then we have a Director of the Veterans Homes, which is Miss Barbara Raymond. Then each of the 6 homes, which you saw on the first slide, where they're located in Pennsylvania, has a commandant, which is the nursing home administrator at that home. As well as what I work with, as you'll see later on in the presentations, is the admissions staff among some other staff at each of the homes. The next 2 slides are basically the mission. I'll just give you a minute or so to look at that. Again, it's just our mission statement. The bottom couple words in there are veteran surrounded environment. That's a little bit what makes us different than the nursing homes, extended care facilities out there. So I'll just give you a minute if you like to read that. The vision statement, the same thing. What we want to do is, like I said, general awareness, information. You work in the business, you understand, you're aware that there are the 6 homes, that we're a long-term care provider for the veterans of Pennsylvania. Okay, the next few slides is really breaking down the whole admissions process. Again, we start with a basic application. It's broken down for 6 parts. There's general information. We need military service records. So we're going to talk a little bit more about that. We need their financial information. Pennsylvania residency becomes a big part of the whole process for us. The 2 medical forms that are essential part of the application is the medical assessment 51 form and also the activities for daily living assessment sheet. The last part is basically outreach survey, but it's important to us because it helps us find out where veterans found out about us to help other veterans. So again, I'm going to break down each little part of the application a little bit more. Next slide. The general information, we do get veterans that will reapply, and we look for that if there is any history in our database that they applied, because we can use their military discharge. We may have it on file, which typically the DD-214, which is the discharge paperwork from the military when they get out of the service, that has their qualification that qualifies them for any VA benefit. Which we are part of the VA, but we're subsidized by the VA. Because again, we're run by the Commonwealth, but we're subsidized by the VA. So we need that military discharge to get them into extend into one of the nursing homes, one of the Pennsylvania veterans homes. Again, if there's a power of attorney, I think maybe some of you probably have worked with that, maybe even worked with some of my homes on it. We do need a copy of the POA or legal guardianship if one does exist. Next slide. It's mentioned the military service record is really what sets us apart. It's very important because what we are subsidized by the VA is for state homes per diem. So yes, we get per diem from the federal government, which helps pay for their care. And we look for the DD-214 if there was federal active duty. We look at there's a lot of reservists, National Guard that have been deployed overseas. They may not have been federal service, but they actually may have fulfilled a whole deployment being overseas that would qualify them. So we got to really look at each individual on a case-by-case basis. We always look at if they're service connected, if there was some type of disability that was caused by their service. We look at that as well because they have a service-connected disability with the VA, and it all goes into the cost of care, what each individual will be paying. So again, that military service record is very important part of the application process for us. Next slide. I mentioned the financial. We work with the VA. This is actually a number off, kind of just came out in December. It's someone has a threshold for VA pension. If they have more than that assets and income of 150,538, they would be full cost of care until they're paid below that. Approximately everyone is really on a sliding scale, but the general maintenance fees, what they pay out of pocket monthly, is approximately 80% of their income and assets. There you see what the average cost is. Now, only 3% of the whole 6 homes population pays that. It's based on their military service, if they have, which percentage of service-connected disability they have. It can be what assets they have. So it's all set down basically case by case with each of the homes revenue office prior to accepting a bed offer. We do provide the families, the power of attorneys, with a financial checklist, and the revenue folks take over and prior to them moving in. So we will not let anybody move in and without them knowing exactly what their monthly maintenance fee would be. Next slide. As I mentioned, the service-connected disability, if a veteran is 70% to 100% service-connected disability, disabled from military service, something in the line of duty, we get payment from the VA for that veteran. So their assets and they have those. So we get paid for their health care provided by one of the Pennsylvania Veterans Homes. Another program we have specifically for the Pennsylvania Veterans Homes, it's basically a Medicaid program called an Enhanced Veterans Reimbursement. The monthly threshold for that program is $28.23. So yes, we've had some people that are not 70%. They have come in and paid full cost of care, and then we ended up paying a maintenance fee, and then we ended up applying for EVR for them. One of the programs that we have set up through EVR is that the resident is in our home will get a $450 allowance as opposed to a $45 allowance in the private homes. The mentioned a lot of the maintenance fees and what they pay out of pocket. Their total cost of care is what the total cost of care, depending on how long they are there. We would apply the difference between what they're paying on a maintenance fee to what would be on in a state bill. I know you have worked some of this. If there is such an estate available at the time of their passing, our legal counsel works this daily. That's kind of a little bit, like I said, with the revenue offices, work a little bit more of that. I'm mainly the admissions guy, the outreach to get them in and get them on the list, which I'll talk a little bit about how the lists work here coming up. So go next slide. Again, we will take deductions. We know a lot of veterans may still have a spouse in the community. We'll take that into consideration, that we won't look at the spousal income if they're still living in the community. So that's, again, it's through each of the home have a revenue office. I'm going to break down each home in a further slide here. Next slide. This, as I mentioned already, is very important. We are a Commonwealth of Pennsylvania. Again, we looked at DD 214. If someone, say, joined in Pennsylvania, but like moved to Florida and they don't want to move back, they basically have to reestablish Pennsylvania residency before they would be put on what we call the primary wait list. We have a secondary wait list, but through a relation, we bring only people in that are on the wait list in Pennsylvania. So the thing with the veterans, we encourage that the people living here in Pennsylvania would have priorities with the veterans. So that's kind of a lot of people are unaware, because we get a lot of families, like the veteran no longer lives in Pennsylvania, but the son or daughter does. The benefit is for the veteran that lives in Pennsylvania. So that's kind of the residency we do. We work, again, it's a thing we work daily, kind of case by case. So many veterans out there, and we work off our wait list. Next slide. This is what's essential, and I have a little bit later on the medical forms. The medical assessment form, the MA 51 shows us that the local doctor signed it, that they need long-term care. They need some help. The ADLs, I'm sure you all work with that as well. The activities of daily living is essential for the people. Yes. I guess the thing popped up. Yes, the state recovery plan is like the state bill. Excuse me. Again, the two parts of the medical parts of the application, the MA 51 and the ADL sheets, signed by the local doctor. I always tell families it's the doctor that knows the veteran best. Yes, we get a lot of referrals right from the VA, so a lot of times it'll be signed by the VA doctor. We've kind of looking at our ADL sheet, trying to even being more inclusive, even adding to it, which can be because we'll use medical notes. If we may even do like an on-site assessment of a veteran, if we can't determine the committee at the home cannot determine the level of care. Looking at all their history and everything. Again, case by case, so many things that the applicants are never really like any two alike. Next slide. I mentioned the outreach survey already. Again, it's very important to us because how'd you hear about us? It can come from word of mouth. Really, they had to find out about us somewhere. Word of mouth, though, is I still say is the best advertising, but we know they had to find out about us somewhere. A lot of what families that we deal with are military families, so they find out about us. I mean, people call me every day. I get that Teams calls, I get cell phone calls, I get emails on the state resource account that people, how they find out about us, somebody told them. Or my father talked about if he ever has to go into a nursing home, he's a veteran, he really wants to go. I had a son today and I said, well, that's good. He's a couple months out because I said it's going to be at a minimum, probably 2 to 3 months at my Hollidaysburg home for wait time. That would be the shortest. So that kind of call worked out. So again, that's kind of the outreach survey. We have it on the application because it's very important to find out how veterans found out about us, so we can find out, they can word of mouth, talk to other people about the veterans homes. Next. This is just recapping kind of everything I mentioned already. Again, you have to be an honorable discharge veteran from Pennsylvania. Could be out of state, but you'd be on a secondary wait list. Shall make a monthly payment, which is the maintenance fee. The Commonwealth can recover the cost of maintaining a person through the home, through the recovery plan. We're not going to deny someone based on payment. We may deny somebody based on we can't provide a level of care for them. They have to be approved by the admissions committee at that specific home that they want to go to. We do everything first come, first served. All applications are stamped. They work the applications based on approval from the admissions committee, top to bottom, every day. All 6 homes do that. I did see another question. I don't know if that could be popped back up. Something about the New York homes. If not, we can get to it at the end.
It says that Janine is impressed with the Pennsylvania Veterans Administration home. New York State's VA's nursing homes are run by the Department of Health. Nothing like this.
New York State is run by
the Department of Health, the New York State Department of Health, I presume.
Okay, thank you. You're going to see something. I think that slide's coming up. So yes, so you could, yep. Yeah, I have a slide coming up. You're going to kind of referring to what you're talking about. This again, just a slide of pictures of a lot of activities that take place at the homes. Each of the 6 homes have a canteen. I mentioned like the EVR, the veterans have a little bit more money in their pocket. They can get things. I see some of the guys in what's called the personal care wing playing pool at Southeast Veterans Center up there on the right. All right, next slide. This is the slide you're referring to. This is, again, you probably are familiar with by seeing this, but this is a lot of agencies and outside folks looking at us, different organizations work with the VA I've talked about already. Anything from the local, a lot of veteran service organizations have interests, American Legion, VFW, a lot of organizations, that work with us and provide help. So there's a lot of people involved with the Pennsylvania Veterans Homes. Next slide.
What is
Uh,
VSO? In your last,
I'm sorry?
there we go. What is VSO?
Oh, Veteran Service Organization. That's veteran. It would be the American Legion, the VFW, the Veterans Foreign Wars, the Catholic War Veterans, the Jewish War Veterans, disabled American veterans. There's quite a few, but there's a lot of organizations out there. So that's very important to know, because yes, they are involved with all the homes, and there's a lot of involvement. Again, this is some of the things we do, and right now is it is holiday visits from the Adjutant General. He has been out there. He was at the Southeast Veterans Center today for a veterans breakfast, and he's headed to the Delaware Valley home tomorrow in Philadelphia for a dinner. So it is, command does get out there to do different things with the veterans. One of the things we do here that I don't think any other nursing home out there does, we really celebrate Flag Day. And Flag Day week in June is what's called State Veterans Homes Week. Every home has a carnival. They'll have a Flag Day ceremony. The veterans like it because it's really rallying around the flag, a patriotic week, and we do that. The sharing caring up there is basically a boat ride out in Pittsburgh that the 3 Western homes do. The fishing derby, we do that in June here at Forty Town Gap. We bring the 3 Eastern homes in, and they have basically a fishing derby, and the veterans are very competitive to see who can catch the most fish. I already mentioned the holidays this week, and again, 4th of July, different patriotic holidays that we'll do things, especially, of course, Veterans Day in November. We'll do a lot of things as well. So that's some of the things we do. The next few slides is kind of a breakdown of each of the homes, which I mentioned on the first slide where they're located. Delaware Valley is in the city of Philadelphia. It's in the northeast corner of Philadelphia. One change on this slide, which is a really good news story, just since I put the slides in last week, the 51 additional beds have been certified, and the Delaware Valley homes should be starting to fill those beds come January, February timeframe. So a few things we have to work out with the VA, but that's going to be moving forward with those beds to fill more beds for veterans in the greater Philadelphia area. Each of the homes I mentioned, nursing home administrator is the commandant. They're also a deputy commandant, which would be also a nursing home administrator. Each of the homes have a missions team, which I work with, and activities, which I've worked with a lot, some of the public relations stories, some of the outreach stories, the activities folks at each of the homes. And what's really important too, volunteer coordinators at each of the homes. You had asked about the veteran service organizations. That's who they work through, getting donations or getting people in to volunteer. Things have changed a lot in the course of the last couple of years with COVID, but we still have people helping out, and people have come back in working with the canteens and so forth. I've already mentioned each of the homes have a revenue office. Again, we work the admissions process, kind of get them into the home, get on top of the list, and then kind of our revenue office takes over at that home to get the veteran or the spouse of the veteran into the home. Next slide. Gino is right in downtown Scranton. It's kind of interesting because the location was once the site of a state hospital. And it's really interesting because it's a lot of folks from Scranton will be living there. There was a lady that we had living there, and she was again 100 and 102 she lived till, that had been a nurse at the state hospital that was on site. Then she at where it was actually located, at the same place where Gino Murley is located in downtown Scranton. Sarah Butler is my coworker there. Is the first line of communications for admissions for any questions. I know she's worked with a lot of people for a long time in the community. And there you see that, like, again, volunteer activities at each of the homes. Next slide. Hollidaysburg is the largest of the 6, located right in the center outside of Altoona. There's the folks there. And probably some of you may know, Community Living Center is kind of the future. They have been in the works at Hollidaysburg for some time. They are supposed to break ground next year, which of course is only a week away. So that not breaking ground next week, but sometime during 2023, probably the spring timeframe, to break ground for a new facility at Hollidaysburg. I do have aerial shots of all 6 of the homes, so we kind of get a picture of how large some of the homes are and how some are city, some are rural. Hollidaysburg, very rural, as you can see, a lot of open land right around Hollidaysburg. Soldiers and Sailors is the oldest of the 6 homes, located in Erie, in town. Now we're in town, but it's not far from Lake Erie. Again, it was from 1886. It was veterans from the American Civil War that really was established for. And yes, we're still for a veterans home today. They're going to see the staff there, but again, the personal care wing there at Soldiers and Sailors is the original building from 1886. Next slide. We move into the southeast, which is the 2nd largest. And the Community Living Center, which I spoke about, is the building in the picture on the right. That would be the newest construction in the homes until we move forward with Hollidaysburg. That's the CLC, as you can see the folks there. One thing I do say, we do always work for capital renovation products. Like I mentioned, we just finished the one at Delaware Valley to get the homes recertified, and we'll be re-admitting more people into the homes at Delaware Valley. So we have folks on staff that construction people that work like administrative projects all the time. So always looking, trying to improve the homes, the folks that do that here. Next slide. Southwest is Pittsburgh. Again, it was opened 1997. There's the staff. You can see Pittsburgh. One thing about Pittsburgh, very involved with the communities, the volunteer coordinator. Again, trying to get the guys out in the communities. I already mentioned the sharing and caring boat ride that they go out on the 3 rivers. Again, we look at different things we've done, like with the Pirates, or I have to get back to you exactly. That's a very good question. I'll get you my emails on the and last slide. And so just if you send me an email, I'll get that. I'll get my construction guys tomorrow and get you an answer on that. For the question was how many beds are planned for the CLC at Hollidaysburg. So I'll get you exactly how that will be. All right. Again, I do this. I've done this quite often, not as well. Zoom and Teams the last few years, a little bit more. I've only been a couple of times out at the VA once, but most of the briefings have been virtual. And we can do this virtual. They have somebody else. I can come out live, or we can do something else virtual. But one of the things when I do this, especially when I do it with what we talked about, the veteran service organizations, it's kind of how anybody can help us. We help you, you can help us. Again, just being aware that there's 6 homes out there. Especially the veteran service organizations, finding the DD-214s. What the veteran was informed to do when they returned from service was have it recorded at the recorder of deeds office at their individual county. So we take a lot of calls daily that the families can't find a DD-14. A couple things that we tell them is, did you check with the county Veterans Affairs office? Because they can go to the recorder of deeds and it may be there. And a lot of times they are. Another time we tell families to find a military discharge. I always use to find personal. I come from a military family. My father always kept it in a little metal box, which was, of course, a fireproof box. So a lot of times the veterans will have a copy that the family don't even know is in their personal files. So that's essential that the family gets that military discharge for us. Not really just for us, at the veterans home, but really any military benefit. Again, I mentioned social workers of the VA. We get a lot of people involved to help out with different veterans, finding just the medical documentations. It's very important that they get what we need to get. So each admissions committee at the particular home where the applicant wants to reside has the information that they can get cleared through the approval process by that home's admissions committee. We talked a little bit about VSO. Yes, we do work a lot with the state representatives and the senators' offices. Sometimes they'll get involved with that. Sometimes at the last resort there is the National Archives, which is out in St. Louis. It's been a little slower since COVID, but again, it's a depository of all military documents that we could send somebody out there. We do work a lot of times with state reps or with again, it's just like the first thing that needs to be for any military benefit to have that military discharge. I can't say how important that is. Again, like we were talking about working with the different organizations throughout Pennsylvania. And again, a lot of volunteers have come into the homes and helped us out. So we'll go on to the next slide. I have like this slide put together really so you have the main number at each of the 6 homes. The important thing is the admissions office at each of the 6 homes. Again, we deal with each 6 homes admissions office pretty much every day. I do have a staff here, both administrative assistant and a clerical assistant. Work with the applications daily. We work the applications pretty much every day with that admissions office at the home, back and forth. The volunteer office is, yes. Okay. The volunteer office is very important because it is, like I said, we will take volunteers, we'll take donations. We thank folks that have donated to us, especially this time of year. A lot of Christmas cards have been sent to the veterans from different organizations, schools, churches. They're all good. We get them out to the veterans and they like seeing them. So that's a good thing. That is important with the that you have the volunteer office, the missions office, the main office. But the main number, obviously, you can always, if you have another department to call, you can get referred to, like again, we may have a family call their social worker at the state veterans home. So that's the call in for that number. So that's important numbers. Next slide, I believe, is more my information. Yeah, that's me. I'm glad someone asked about the CLC at Hollidaysburg. I will try to get you that answer. If you just send me a quick email tomorrow, I'll get my construction guys, and they'll be glad. I'm kind of glad that was asked, because I did talk to them the other day on that. Because I said I did want to make known that we are always trying to improve what we have for the veterans. I know there were some other questions in chat. Again, this is what we call the Homes 101. I guess we were a little over a half hour. Again, I just looking at this, will do that. That we are, the Pennsylvania Veterans Home. We want you to know that we're part of the DMVA. We're not the whole part, as Chip's going to be on next, but a big part of the DMVA, that there are 6 homes across the Commonwealth that we would do have long-term care for veterans and spouses of veterans. I did talk about spouses a lot. I just want to make sure that you're aware. We only go to a 12% census for non-veteran spouses. So, because the homes are primarily for veterans. As I mentioned, we work with the VA constantly, from construction to medical information, but the VA subsidizes us with the per diem. The homes are specifically for the veterans, but we will take spouses. Now, if we get a veteran and a spouse, we'll try to do everything we can to bring them in together so they're still together and continue to live their lives at the veterans home together. There's something about the wait list. But yes, there is wait list at all 6 homes. Again, we work at top to bottom, each of the coordinators at each of those 6 homes. I guess I could.
I was just wondering if
Yes.
somebody was on the wait list for
Yes.
one of these 6 homes. There
Yes.
used to be some nursing homes that are not necessarily under the umbrella of the VA that had contracts with the VA and
Yes.
would take people for a
Yes.
certain amount of time. It used to be 6 months, then it went to 3 months, then it went to 1 month, and the VA would pay for it. So I'm wondering, do you do that still? Do you put them?
Yes, you
They
see me
want them-
smiling because I'm glad you asked that question. Okay, and I know you probably all know a lot about the nursing home industry, but there is certain nursing homes across Pennsylvania that are contracted with the VA. Now, they will take per diem from the VA, they're 70 to 100%. I had a couple in rehab. They're in a rehab facility a couple weeks ago. Now they're in one of those facilities. He's 100%, but he's on the wait list for Southeast now. You're correct. With Philadelphia, it does have the longest of the 6 homes. I did mention the new wing being open, but they have worked, I know, with some of the local homes down there that they'll be there, and then they'll move into Delaware Valley when they hit top of the list, and they transfer them in. So yes, if they need, that's one thing that you could probably help me, is because there is people that need immediate placement, and that's really not us. They do find immediate placement elsewhere, and then we will transfer them in when they get to the six homes. Yes, they do have, they work with each of the 6 homes work the local folks with the hospice. Because I know there's a lot of people in and out of the homes constantly. So any other questions? Did I answer that question or not? Okay. All right,
Yeah, I think you did. I was just a
Yeah.
little curious. This might be out of your realm right now, but how many nursing homes in Pennsylvania still have that kind of contract with the VA, or that might be?
No, I have a list. I'm kind of getting up to you right. Again, there's a little older. I mean, it looks like there's about like 100, no, more like 50 on here.
Okay, well, that's quite
And
a few.
again, this list probably isn't up to date, but it is like, I know where I got it was off the VA website.
Okay, thank you.
So, but no, it is very important to know they're out there, because yes, we do work off wait lists. I mentioned Philadelphia is the largest, and the Hollidaysburg would be the shortest. But hopefully we're going to move Philadelphia once we get the folks coming in here in early 2023. So, any other questions, or do we turn it over to Chip, because he's going to talk about a lot of other veteran benefits, and you'll see how some relate.
Jean, there is a question in the chat. How many of the 6 veterans homes in PA have hospice care implemented?
Really what we do, it depends if the veteran, what they're looking for. I know there's some families we have sent out for hospice, and there's other people we brought in. I may not completely follow your question. I do know, like I said, they work with the folks, and again, it's case by case, it depends where they're at. I've been told by the administrators at the homes that this veterans in hospice, and we hope they're doing better. So, and then we really have celebrated some of the birthdays, and the patient is celebrating their 100th birthday. And it's a good thing. So I don't know, maybe you can send me an email if I didn't completely answer that correctly. what you're looking for, because I'll find out from my nursing staff if there's something specific.
Michelle, does that answer your question? Nodding yes.
I think we've had both. So again, it looks like some of you have worked some of the homes, so that's good. But I want to say both. So okay, that'll be fine. I'll talk to one of my nurses. And then somebody else wanted to talk. I'll talk to one of my construction people for you on the CLC at Hollidaysburg. So, all right. Is there anything else? Yep. See, I guess I understand everyone. There's people from all over the state on here. If that's correct.
Yes.
Okay, because of course, like I said, I'm at 40 Town Gap. The first slide showed we're all 6 homes, and yeah, Gino Murley is downtown in Scranton. So. And thank you for those who have worked with the homes, and especially if you worked with my admissions coordinators at each of the homes, or you've worked with the volunteer coordinators. Thank you. Very important. If you wouldn't mind, send me an email on that one, because I'll follow up with management. That's a very good question. I do know that someone's from New York. It's a Stony Brook nursing home off of Long Island. I know some of our folks visited there several years ago. Thank you I've seen some good comments coming through, so thank you.
Well, thank you so much, Jean. We'll definitely keep track. If there's any more questions, we'll make sure we get those to you.
Okay, and I say to New York, I have reached out to New York in the past, especially with veterans in Erie that were not Pennsylvania residents, that were at the Erie VA. And how that happened is that, again, like the Martinsburg, West Virginia VA, Pennsylvania residents from Chambersburg will get care there, but they're Pennsylvania residents. There'll be veterans from New York that are Western New York will go to Erie VA, but they're New York residents, not Pennsylvania. So I have worked a little bit with New York. So, okay, well, thank you, everybody.
Thank you so much. Now we'll turn it over to Gilliland. He's the Chief of Reintegration and Outreach. He's going to give us an overview of the Veterans Affairs Program.
All right, can everybody hear me? Good evening.
Yep, we can hear you good.
Okay, good. Want to start the show? There we go. Next slide. So when you talk about Pennsylvania, we have the 4th largest veteran population in the United States. If you could go back one, Jamie. Oh, go ahead. So the other states that have more veterans than us are Texas, Florida, and California. And that is mainly due to the big US military bases in those states. Next slide. There's Pennsylvania, 719,233. Next slide. Okay, whenever we talk about benefits for veterans, we talk about 3 levels of benefits: federal, state, and local. And we at DMVA, we're the state benefits portion. Next slide. Next slide. So just like Jean's Bureau of Veteran Homes, we have a Bureau of Programs, Initiatives, Reintegration, and Outreach. And that bureau is then further divided into 2 divisions. excuse me. The one division is programs and services, and the other division is reintegration and outreach is what I take care of. Next slide. The division of programs and services, they are basically responsible for the benefit programs that we have here in Pennsylvania, and they manage those. They do the eligibility for them, and they do the payments for those programs. Next slide. So here's some of the programs that we offer at the Department of Military and Veterans Affairs. We have a blind veterans pension. That is a $150 a month pension that a veteran can receive whenever they are rated by the VA at a certain percentage of blindness. We have the education gratuity program. That program is for 100% service-connected veterans, and their children can receive $500 per semester hour if they qualify for that program. We have the disabled veterans real estate tax exemption. That program is for 100% service-connected disabled veterans that are permanent and total, and they fall within below a monetary threshold in their income. And in January, that income will be like 108,000. So if the veteran makes less than 108,000, they could be eligible for real estate tax exemption. That's probably our most popular program. The amputee and paralyzed veteran pension, that is a $150 a month pension to veterans who qualify for that program. We have a Pennsylvania Veterans Memorial here at 40 Indian Town Gap, located at the Indian Town Gap National Cemetery. It's a state-owned memorial, but it is on federal property, and we maintain it. We also maintain a discharge database, like Gene was saying with the discharge documentation. We can assist veterans to get their discharge document. Probably from about 1995 to present, we have a pretty good chance of finding their information. Anything prior to 1995, the best place for an active duty individual is to go to the National Archives. But we here in 40 Town Gap maintain the discharge documentation for Pennsylvania Army and Air National Guard soldiers and airmen. So if a individual was discharged from one of those two entities, they can contact our office, see if we can get their service records for them. We have a Pennsylvania Veterans Registry. People go on, register with us. We're trying to figure out where all our veterans are in the state. And when they register with us, then every week we send out a digital digest that has a lot of great information in it. So if you know a veteran, go on our website, register with us, and they'll be able to get that information. We have a DAV transportation program. That is a $336,000 a year budgeted line item through the state government. We grant that money to the Department of Disabled American Veterans, and they run the vans that you may see at the VA medical centers, and they provide that service for veterans. We also service officers, we accredit them. All the county directors within the state are accredited with us. And then we have a burial honors program that we give money to veteran service organizations that perform ceremonies for veterans once they pass. Next slide, please. So we talked a little bit about the registry. Like I said, if you know a veteran, go in and register with them, and they'll be able to get a hold of that weekly digital digest. And like I said, it's got a lot of information in it. Next slide, please. So this is my division, the Division of Reintegration and Outreach. We are responsible for outreach efforts throughout the Commonwealth of Pennsylvania, and we do that a couple of different ways. Next slide. We have 2 mobile outreach vans that go all over the state. They're basically rolling offices. We'll go to any event that we think that we can go in and get contact with veterans. As you all know, Pennsylvania is a very rural state, and there's a lot of veterans out there that we don't even know that are out there. We probably know where a third of our veterans are. So we use these mobile vans to go out to events like county fairs, hiring expos, senior expos, any kind of legislative event that veteran breakfasts, lunches, and dinners. And we go out, and what we do is we try to interact with veterans and provide them knowledge and education on what programs and services might be eligible, they may be eligible for. Next slide. So this is one of the group programs that we manage within the department. It's called the Veterans Trust Fund. If you have ever renewed your driver's license or registration in your car, there is a little check block on that application, and it says $3 to the Veteran Trust Fund. Whenever you check that block, $3 of that money comes into our department, into the Veterans Trust Fund. We typically get about $1.2 million a year off those checkoff donations, which proves that we have very patriotic people here in Pennsylvania, and they graciously donate money to help take care of our veterans. You can also by honoring our veteran license plates. We have 4 of them, and $15 of that plate comes into the Veterans Trust Fund. That Veterans Trust Fund is managed by our department. We absorb all the administrative costs, and every penny that comes into that fund goes out to help veterans in 2 different ways. One way is that every year we do grants for 501c3 charitable organizations and veteran service organizations that have programs and services for veterans. We grant typically about $800,000, but this year we granted out $1.2 million to veteran service organizations, charitable organizations, and county directors for Veterans Affairs. The other thing that we do with that fund is that we run a program called Veterans Temporary Assistance. If a veteran experiences a significant increase in expenses or a significant decrease in income through no fault of their own, they can get a $1,600 one time a year grant from us to help them get out of the situation that they're in. And we typically assign $800,000 to the Veterans Temporary Assistance Fund. Next slide, please. Okay, this is Gene's stuff, so you can, next slide. Next slide. Next slide. And next slide. So the other type of outreach that we do, about 2 years ago, we started a program called PA Vet Connect. And what we've done is that we've divided the state into 5 regions. Go to the next 2 slides, Jamie. There we go. We divided the state into 5 regions, and there are between 13 and 15 counties in each region. What we have is we have teams inside each of those regions. We have a regional program outreach coordinator and 2 veteran service specialists that what they basically do is they go out into the communities and they find all the resources there are in that region for veterans. We're talking state assets, we're talking federal assets, we're talking charitable organizations, any kind of organization that has a program or some sort of service or resources for veterans. We go out and we find those folks and bring that information back, and we put it inside a resource and information tool. And then right now we have about 1,800 resources in that tool, and we're getting ready to go public with that R&I tool. So it'll be available to the public here probably in about 2 months. But the 3 people that enter those regions, they're our heart and soul of the program. They're extremely passionate about what they do. They are certainly veteran advocates, and it's amazing the situations that they get to assist veterans that they figure it out and they get it done. I mean, It's like building ramps, getting a, an electric wheelchair for a veteran, or getting heating oil for somebody. I mean, it's just totally amazing, the contacts that they have out there within the communities, and are able to assist those kind of unmainstream types of resources for veterans. Next slide, please. And these are the folks that are out there inside the communities. Like I said, Jamie, you can certainly send this presentation out to whoever needs it, and then they'll have their contact information. So next slide. And this is pretty much what's in our information and resource database. Veteran benefits and services, faith-based organization, food, transportation, substance abuse recovery resources, domestic violence. I mean, anything you can possibly think that a veteran may need to help them whatever situation they're in. My folks typically have or know of a resource that will be able to assist them. Next slide.
Chip, there's
Yes.
a question in chat for you. Can we make sure that the Virtual Family Council gets the resource list when it goes public?
So whenever it does
Well,
go
that-
public, anybody will have access to it. So we can make sure that, especially Sam Kosman, who kind of set tonight up, she will be well aware of it, and she'll get it out to you folks, or let you know how to access it anyhow. All right,
Thank you.
you're welcome. Next slide. This is kind of what our website currently looks at, or like. It'll look familiar to this in the near future, but it'll have a lot of stuff going on in the background that's going to make it a lot better. So next slide. And how the website's set up is with these tiles. If you see a blue tile, that is a state program. And if you see a white tile, that is a federal program. So you'll be able to click on any one of those tiles and find the information that resides within that tile. Next slide. So the other layer of benefits for veterans and their families is the federal. And we partner with the federal VA throughout 3 different administrations. One is the Veterans Health Administration, who deals with healthcare and all the VA clinics and hospitals within the Commonwealth. The Veteran Benefits Administration, and whenever we deal with the VBA, that's whenever we are sending claims in for veterans for either service-connected disability compensation or pension for them. And we also work with the National Cemetery Administration. Like I said, we have a national cemetery here in Indiantown Gap, and oddly enough, it is rated the #1 cemetery in the United States for how it operates and the aesthetics of the property. Next slide. So the Veteran Benefits Administration takes care of, like I said, claims, disability compensation, vocational rehab and employment, education and training. And then you get into the Veterans Health Administration, and they are pretty much take care of all the things that are listed under there. Any kind of health care that a veteran may need or qualify for, they can receive it through either the VA hospitals or the clinics. And once again, the National Cemetery Administration, when a veteran unfortunately passes away, they have a very nice place to rest. And it's a good thing to know that the area that they are resting in is so beautiful and well maintained. So next slide, please. So here in Pennsylvania, for the most part, we are part of VISN 4. VISN is a veteran integrated service network. And within VISN 4, we have 8 medical centers, 34 outpatient clinics, and 12 vet centers. If you notice that 2 counties up north, Potter and Tioga, they are part of VISN 2. And there's 2 counties down in the south central part of the state, Franklin and Fulton, and they are part of VISN 5. And then we actually have some other parts of other states located within this vision too. The VA Health Administration divides the United States up in these visions, but for the most part, we're in Vision 4. Next slide. Next slide. Can everybody still hear me?
I
Yes,
hear
There
you.
we
I
go.
can.
Thanks,
Yes.
Jamie.
I hear you.
And okay, so the final level of benefits for veterans is county and local. And for the most part, we deal with the county directors for Veterans Affairs. Whenever you talk about the county directors, there is a county director in every county in Pennsylvania. So we have 67 county directors out there, and they all operate at various levels. Some of them have very robust offices in, like in the cities and some of the bigger metropolitan areas. And whenever you start getting out into the counties that are what we call in a T, and that's the counties across the top of Pennsylvania and down through the center, they may only have one person in their office. So they are charged with taking care of veterans within the county. For the most part, they work for the county commissioners, and they don't work for us, but they work with us very closely. In the first couple slides, I mentioned that we do accreditation. All county directors by law and statute are required to be accredited through our department so they can operate. So next slide. And basically, they are the tip of the spear for us in the communities, much like our regional folks. The county directors know what's going on in their counties for veterans, and they are the key element for a veteran to go for assistance, or if he's wanting to file a disability claim or a pension claim, those are your go-to folks within the counties. Next slide. Here's some of the things that the county directors have benefit-wise. Gravesite registration, grave markers and flags, private headstones, divorce records. They have discount card programs, some assistance programs, and one of the key things that a veteran can do once he receives his discharge papers is to go register it with the county recorder of deeds. That way, if something should happen to him, the family knows exactly where that document lives, and they will need that for most VA benefits. Excuse me. Next slide, please. Okay, we had mentioned the VSO, the Veteran Service Organizations. VSO can also stand for Veteran Service Officer as well. So this is a grant program that we manage within the department. It's a $3.7 million a year budgeted line item by the state government. And we currently have 5 organizations to participate in that grant program. The American Legion, the American Veterans, the Disabled American Veterans, the VFW, the Veterans of Foreign Wars, and the Vietnam Veterans of America. What we do with that grant money is we grant money out to those organizations, which provides the salary for accredited veteran service officers and administrative staff and equipment that they're able to go out and perform outreach to interact with veterans. Currently, that gives us about 60 more veteran service officers within the state, and they are basically a force multiplier for us. There's not a lot of VSOs in the state of Pennsylvania, probably close to 200. But this grant program actually gives us the ability to get at least 60 more out there in the communities doing things for veterans. Next slide. We also work very closely with the Pennsylvania National Guard, as we are, like they are, a part of the Department of Military and Veterans Affairs. So we work very closely with all the family readiness groups out there, and we work back and forth assistant veterans and service members for whatever need they may be. So like I said, we work very closely with them. Next slide. The Pennsylvania Army and Air National Guard both have health programs, and majority of the time it's the mental health programs. So they have a lot of social workers out there. They have people that a Guard member can call and get assistance if they need it, if they're having some challenges with mental health issues. Next slide. So we have some best practices that we like to use. Instead of asking somebody, are you a veteran? Ask them if they've ever served in the armed forces. We have run into veterans who did 4 years of active duty in the service during a period that wasn't a conflict, and they don't consider themselves veterans. Some people only consider themselves a veteran if they've been to contact or been deployed. Well, that's not necessarily the case. So to kind of break through that barrier, we ask, have you ever served in the armed forces? We like to do a warm handoff to county directors whenever those veterans aren't necessarily geographically co-located with us around Fort Indian Tower Gap. So we do have those county directors to refer those folks to go get assistance. And you personally don't need to make the determination on veteran status or eligibility. Let us, the veteran service officers and the county directors, do that part. I mean, that's why we get paid. So widows and dependents are also eligible for VA benefits in some cases, and the county directors and the veteran service officers know about those eligibilities as well. Next slide. So the key thing is that a veteran or their beneficiary should never pay for assistance in applying for veteran benefits. Always refer them to an accredited veteran service officer. And aside from the county service officers, accredited veteran service are also available here at DMVA. We have staff located in the Philadelphia and Pittsburgh regional office. And like I mentioned a couple slides ago, the veteran service organizations that we grant money to provide that service. So nobody should pay for any kind of service whenever it comes to looking for VA benefits. And a veteran should never pay to request his service records. There are companies out there that will charge a couple $100s to say that they can get a veteran's record. Well, you know, if you go through a accredited service officer, county director, it's free of charge and the veteran won't have to pay. So next slide. Questions? And Jamie has my contact information if anybody would like to reach out to me with a question. If a veteran is service connected, does that affect how much your spouse has to pay to live in a VA loan or VA home?
No, actually, as I mentioned, the veterans homes are primary for the veterans. We will take the spouses up to 12% census, but they will not get the per diem that we get from the VA. So no, the spouse would be basically 80% of their income and assets would be their monthly maintenance fee, depending on, of course, if they're below the threshold that I talked about. And yes, we can apply for like the AVR for the veterans, the spouses as well, if they're below that threshold.
Okay, thank you, Gene. Any other questions?
There's a question in the chat from Carol Diefenbach. Do the county veterans directors go to see people who are veterans in their home setting to get services?
Yes, if a veteran is basically housebound, a lot of county directors will make a visit to the home to assist the veteran.
Thank you.
Yep. Any other questions? All right, well, thank you folks for entertaining our presentations tonight. We hope you learned a little bit of something, and you know, Jamie, you have our contact information. If somebody would like to reach out to us, please do. We're not like the federal VA. We actually answer the phone and emails whenever we have them. So we kind of pride ourselves on that. But no,
Absolutely.
thanks everybody for letting us come, and Merry Christmas. Have a prosperous New Year, and thanks for your participation tonight.
Lots of thank yous in the chat. So thank you so much for presenting.
Lots of in the chat.
All right, thank you.
All right. So we'll just review our upcoming meeting topics very quickly. Since we are meeting monthly now, we do have a meeting on January 17th where we're going to hear from a life program and get an overview of what services they offer. And then we're still planning out your February meeting, but we have some good ideas. And as always, thank you so much for attending. If you have any specific questions, contact the State Ombudsman Office, either 717-783-8975, LTC-ombudsman@pa.gov, or you can hop on over to our Facebook page. And we will be sending out the PowerPoint presentation for this evening. If anybody needs any follow-up information, I know they flew through a couple of those slides pretty quickly, so we'll be able to reference those. And then the recording of this will be available on Facebook and YouTube, hopefully by the night's end. So thank you so much, everyone, and have a great evening.
Can I ask a question?
Sure.
I just got on your website. A good friend has been going to your presentations. I am a senior and my husband passed in a pretty good environment, but I had to really look. And so I have a couple of friends who are working very hard on things like mold and the other kind of stuff going on in some of these senior places. And I didn't know if you had a presentation, you know, in the archives that I might access.
We do have quite a few. I don't think we have anything specific to like infection control or those kind of things.
Well, I'm talking about very posh facilities. I live in Philadelphia, so it's around that area, where everything looks good until there's a leak and the contractors that are hired are not competent. And then everything's supposed to be fine, but you've got to put a dehumidifier or something in your closet so there won't be mold on the plastic bags of your clothes. And so it's the kind of situation where whoever is running those things, and many are for nonprofit, but they don't hire competent people. And the residents, I am not one, but I have friends who are. Many of them say, look, I'm here, I don't want to make waves, blah, blah, blah. So I'm just looking for more information.
Sure, we have some overviews on the ombudsman program and residents' rights, and then we have some for licensing agencies as well. So you can always do anonymous complaints as well.
Well, I'm talking to people who have been through hell and lots of money and lawyers and all kinds of. So I'm wanting to know. Well, one of my friends who's on your website a lot said that there is a way to have somebody come and check something in one of those facilities, and that quote, things will happen. And apparently it's very hard to get things to happen. That's why I wanted more information. So
Sure, that could be some of our ombudsmen. So
how do I do that? Email LTC Ombudsman and lay out my issues, and somebody will email back and say, oh, blah, 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 blah.
Oh, yep. We'll get you all your local connections and we'll get you taken care of.
Okay, let me just, don't go anywhere where I've copied down your email. I realize I have something on my computer, but I am not technologically very good, but I'm getting there. And this was really interesting and good to know you're there. don't at this moment have veterans that are related to me, but just to know that the programs are out there is really helpful. So thank you so much.
You're welcome, and thanks for joining us. Hopefully we'll see you next month too.
Okay, thank
All
you,
right.
Jane. And happy everything, everybody.